Good evening, ladies and gentlemen. Thank you, organization, in inviting me to present lymphoma challenging cases. In next 5 minutes, non-Hodgkin lymphoma challenging cases I will present. Actually, I have nothing new to tell all experts. You are here. Lymphomas are as old as hills. I will just remind you rules of oncology by this case. This is 50-year lady who was referred to us with the B symptom, recurrent infection, poor appetite over the 3 to 4 months. She became progressively dyspneic and she brought with severe pallor and CBC revealed cytopenia for further treatment. You can see first graph here, the hemoglobin was less than 5 and platelets was less than 50,000 and ferritin was high. Other chemistry was completely normal, slightly high LDH. So young patient with the cytopenia, you see first thing comes aplastic anemia, PNH, and MPN or MDS. So first question is, what is the most useful test in this patient? Uh, You can go from phlegm, hemolytic workup to marrow aspiration. We went all the things. Film was completely normal. Imaging, chest X-ray ultrasound, slightly hepatosplenomegaly. All the chemistry was normal, immune normal, bone marrow is normal. Then what to do next? Should we do imaging to find out anything hidden? We did that actually compatible with the ultrasound, hepatosplenomegaly. Only thing they said there is suspected left breast mass. So what to do? 50-year lady, we should do mammogram and also some suspected lytic lesions, so further myeloma workup. We did mammogram, multiple bilateral hypodense mass, but it was category 0. So they requested ultrasound. Ultrasound confirmed there is mass lesion. So no meet, no treat, need biopsy. Biopsy was done that revealed fibroadenoma, and meanwhile, multiple myeloma workup came as a no M protein. Now, what to do? Next is our colleague, chief Arif suggests do a bone marrow because one bone marrow is not enough to close the story. We did bone marrow, and that time chip came with the diffuse large B-cell lymphoma. So what we learned here that goal of non-Hodgkin is first is accurate diagnosis, then which is done now before beginning treatment, review the labs. What is missing here? We can see here fever, splenomegaly, cytopenia, high ferritin, and the important thing is low fibrinogen and high triglyceride. What is this? Yes, this is HLH. This HLH can be secondary to lymphoma. This is because of cytokine storm. And now what is the stage of non-Hodgkin lymphoma? It is 4B. Now we have high IPI score, diffuse large B-cell lymphoma, HLH disease. How you treat the patient? You will treat R-CHOP standard or EPOCH. So if you go HLH, you had to go HLH 0 for treatment. That include actually dexamethasone, etoposide. Now choose smartly that can cover both. So thing is you can use R-CHOP or EPOCH, which contain both steroid and etoposide as well. So to kill one bird. So here is RF approach. We use actually R-CHOP. So to first etoposide dexamethasone given, then chemotherapy was started. So she has completed 3 cycles, then some septicemia, then finally she completed, here you can say the platelets yellow color, it went up, hemoglobin went up, she recovered, Patient was treated 6 cycles, then followed by maintenance HLH protocol. After 6 months, again, patient ended up with severe abdomen pain, and there is bulky mass, high LDH, biopsy confirmed diffuse large B-cell lymphoma. We gave RDF 4 cycle, now complete remission. Patient has logistic issue. She cannot go autologous transplant. However, since 1 year, she is in complete remission. So this is journey of patient. First diagnosis, diffuse large B-cell lymphoma, stage 4, bone marrow involvement with HLH. A second relapse post 3 cycles, she is in CR2. So what we learn here, I just recall you the rule of oncology. Rule number 2 is when you have diagnosis and treatment dilemma, remember ABC, accurate diagnosis, make a wide angle lenses, not to miss diagnosis. Before beginning the treatment, review labs, as we found in this patient, HLH was hiding. Consider a potentially curable option, especially kill 2 birds with 1 stone, which we use etoposide and dexamethasone to kill the diffuse large B-cell lymphoma and HLH both. So rule number 3 is never forget rule number 1, no tissue, no issue, no meat, no treat. So thank you very much for listening me, and then we'll discuss further. Thank you.